Treatment for COVID-19 is still supportive as there is no exact cure for it. The sick only receive drugs to calm the symptoms of the infection, and those who slide into severity end up in the high dependency or intensive care units. Dr. Joseph Kyaterekera says that at this point, they mostly require supported breathing due to the effect of the virus in the lungs.
One of those important key areas is hypersecretion of mucus and what we are calling the cytokine storm observed in COVID-19 patients due to either the lungs have collapsed, what we call atelectasis, or someone has mucus plugs in the respiratory tract.
He says during a cytokine storm, various inflammatory cytokines are produced at a much higher rate than normal.
Remember, the reaction does not stop. It continues on and on. So a lot of mucus is produced and so frequent. So the produced mucus ends up combining with the various components called the cytokines to form a very thick mucus that tends to plug or to clog or to block the respiratory tract.
According to Dr. Kyaterekera, a patient then suffers acute respiratory distress syndrome, which he says has accounted for a significant number of deaths from SARS-CoV-2, commonly known as COVID-19. Here, he adds that giving oxygen may not be important.
Because as it is being administered to the patient, it's not going anywhere. Or if it's going, little is reaching the targeted areas.
So, how should this situation be handled for better outcomes and recovery of the patient?
We need to position a patient in a position medically we term as the awake prone position. The patient is requested to lie on the belly with one pillow on the head, 2 pillows on the chest, 2 pillows below the pelvis, and 1 small pillow on the shins. In doing that, we are trying to relieve pressure from the abdomen, which would compromise expansion of the diaphragm. So a patient is supposed to be kept in that position for at least 2 hours. If a patient is not able to assume the prone position, then other maneuvers also have to be done. For example, for pregnant mothers, we encourage what we call lateral decubitus position, whereby the mother will lie on her left hand side. You need to continue suctioning this patient so that the sputum, which is being formed frequent, is removed. A machine called a ventilator is connected. Then oxygen is pumped manually to the lungs.
Health experts have since the outbreak of COVID-19 emphasized good feeding for a stronger immunity. Dr. Kyaterekera says there are foods that help to relieve the symptoms from the effects of a cytokine storm.
These nutritional supplements may include fruits like strawberry, blueberry, oranges. It includes things like tomatoes. It includes things like olive oil. It includes things like the leafy green vegetables like spinach. It includes things like the fatty fish.
Research about the infection is still